Welcome to the Relationships Inside Out podcast with Doctors Gregory Siebert and Kimberly Murray, licensed marriage and family therapists. Join them on this journey as they explore the ins and outs of relationships.
Well, welcome to Relationships Inside Out, where today we're going to talk about myths of therapy.
Myths of therapy. This makes me think, we often have clients come in, right, for their free consult or whatever, and they assume it's going to be a certain way. Think like Hollywood, Freudian on a couch laying down. I get that all the time.
Wait, that's not how you do therapy?
No. Shocking, but no.
Yeah, the typical psychoanalytic that you see in the movies and shows.
Yes.
Frasier, I think, right?
Oh, I don't think I've ever seen Frasier, but yeah. Mm-hmm.
Yeah, and it's interesting because not only do we hear it from clients who actually come, when we're talking to the community and people know your therapist, they're like, oh, I don't go because I don't buy into that stuff because of X, right? And it's usually like this myth of what happens. One of the bigger ones that I typically see is this idea that it's just talk. How can I benefit from talk?
Yes, and I hear that all the time, even from my own loved ones. They assume my job is to listen all day, and I'm like, that's not it. There's much more than that. So when you talk about it's more than talk, what are you talking about, Greg?
Well, I mean, part of it is what the talk is about. So there is talking involved.
Sure.
But it's really processing and trying to provide some insight to get different perspectives objectively, right? It's the thing that we can't get from parents or we listen to from family and friends. Mm-hmm. So we go here and then we help kind of process through communication. And that's one way, right? Mm-hmm. The other way is like we do stuff like more behavioral activation stuff, like say someone comes with depression. Yeah. Let's get out and do enjoyable activities. There's people who actually, tools. There's people who actually go on like walking sessions and they meet somewhere outdoors and things like that. And there's like a wide variety. And it's not just sitting there again on the couch and talking. It's very intentional. It's very like pointed in the terms of like theory driving it. There's a lot of meaning behind it. It's not just you talking to your friend. That's not how this works.
We help clients to see different perspectives that maybe they haven't considered, or different solutions that they considered impossible before, or connecting the dots. I talk to clients a lot about that, of connecting the dots of if a client says like, why am I this way? Why am I anxious? Why am I fearful of X, Y, and Z? Helping them kind of process through their growing up experiences, their past relationships, any trauma, to help them connect those dots to make not just understanding, but meaning of that experience.
Yeah. And I look at it like, when you're a client, you're in the trees, and us as therapists are clients ourselves. Mm-hmm. So you're in the trees and you have a hard time to see the forest for that kind of analogy. And here you're talking to somebody who is trained and has theory and skills and knowledge to help kind of guide that objective kind of perspective, rather than just like a friend who's objective because they're not involved in it or something, right?
We get that helicopter view so we can walk people through how to get through whatever they're going through.
Right. Yeah. So that's a big myth that comes up. It's just talk, and people don't like talk. And granted, that's very problematic for some. They don't want to talk about anything. And for me, and as a therapist, like that's, an issue. Like if you don't want to talk about your stuff, like that's also not
You have
good.
to come in ready. Therapy is not one of those things where, and maybe this is a myth, right? We can't force people into therapy. For forcing people into therapy, they're probably not going to get much out of it. Yeah. We have to be open and ready to lean into the process in order for it to be helpful.
And I think it's kind of touching on this myth that say they are ready, they come in, there's this expectation that therapy is going to fix them.
Or fix my spouse or fix my child.
Either way, our role is not to fix or provide the solution for you. Because guess what? Everyone in your family, around you, and friends have all provided solutions.
It didn't work.
And they're not working, right? Or you're not listening to them. So how is me giving that same solution it's getting you to that point yourself and figure out what works best for you based on who you are as an individual. And there'll be times that, you don't have a solution for this. And it's more about processing the stress that I think about chronic illness. There's no talking out of that, or
there's no solution
processing out of that.
It's acceptance work.
Yeah.
It's understanding
and grief.
Meaning.
Right. Loss of quality of life, things like that. I mean, and the other part of this is you're not going to leave every session feeling good. Not every session do you leave and you're like,
it's not joyful every time.
Yeah, I know.
That's a tough one to reconcile for people, is when they leave upset that we didn't leave everything in a perfect packaged bow. There are times you're going to leave session angry, sad, hurting, confused. That's not necessarily a bad thing.
Yeah, it's not. And I think the misconception of, and a lot of people use this as their barometer of whether therapy is helpful for them, or whether they're going to continue, is like, I didn't feel good after that last session. It's not helping. It is. It's bringing up the stuff that's painful and we have to process through. And guess what? That's not happening in one session. It's not happening in 2 sessions. It might take several months in sessions to get through this.
And not every session is going to have this huge aha.
Wait,
right?
what do you mean?
I'll have clients who have reflected before of, well, this didn't feel as, my word would be like, it didn't feel like there's as much movement. And that can be okay. Some sessions, there isn't going to be the same broad sweeping movement or a big aha or this massive insight or solution that comes up.
Yeah. I liken it to like hiking. You're going on a trail and not every part of that trail is beautiful.
True.
And it's strenuous. And some of the part of the trails are harder. Some of it's easier. And some of them you get those beautiful scenes and moments, but it's not this consistent. Every time I go, I'm going to get this wonderful thing, right? It's a process. And I think that's where a lot of people have a hard time, is that it's work. And guess what? It's not the therapist's work. It's the work you're going to put into this, from the skill and knowledge and expertise of the therapist to guide you along that journey. And
the work piece. And then I want to go back to the fix me myth.
Oh yeah.
But the work piece, I warn clients up front, the work isn't done in the 50 minutes we're hanging out.
No.
It is done in between sessions. I'm going to give all of my clients every time walk away with homework. Not like school homework, but tools, whether it's mindfulness or journaling or having that tough conversation, whatever it is. That is when the work happens, is between session. It's not, if I show up for 50 minutes, I'm all good.
What do you mean? If I show up 50 minutes, my relationship should be better.
Oh, golly, I wish it were the case.
This is probably one of my biggest pet peeves.
Yes.
And because of what happens when they don't do the work, they come back and like, therapy's not helping.
Well, did you do the tools?
Well, let's explore a little bit. How are you doing with the communication techniques? Oh, we've been busy. How have you been doing with prioritizing your relationship?
No excuse. Oh,
How
you
you
didn't have time.
We had kids, or I'm like, okay. I mean, there are legitimate, but when it's consistently and you're not doing it, I wouldn't expect movement either. And we get that put on a lot. Like, we get that put on us quite a bit. And I think about it like, this isn't my job to fix you or make you better from whatever I'm doing. Like, you have to put in the work from the skills I offer. Like, I kind of tell them it's me offering the tools and you have to swing.
Yeah, 100%. It's got to be consistent. It can't be, yeah, we did a check-in one time. No, it's got to be consistent work. And we can't do that part for you. We can come and give you a buffet of all the tools, insights, thoughts. If you don't apply them, it's for naught.
It goes back a little bit to what you're saying too, of you have to be ready.
Yes.
And with couples, what's so difficult about it, and I think for a lot of therapists, couples are the most difficult. And it's because now you have 2 people, and that's like an extra chance that somebody's not ready. And oftentimes it's not. The other partner drag the other one in. Oh, therapy's not helpful. Therapy's not this. And you're like, oh, well, even the little bit you did or that your spouse is doing has improved it. So it's very interesting. And I think it's very important for us therapists in the beginning to really communicate this stuff. And I do my best to say a lot of the stuff we're talking about.
It goes back to that fix it, right? Our job is not to fix anyone. We'll often have parents who drop off their kids and say, fix Johnny for me, or it's all my husband's fault. No, call them bullshit, team. Especially a systemic therapist. It is a system problem. It is not a person problem.
Yeah.
Right? Even if someone has severe mental illness, how I respond to them has a direct impact on the system's functioning. And so we don't fix people. Even if it is just individual therapy, we don't fix people. We help with kind of processing and moving through, but everyone who's in the room has to be able to identify their role and buy into mutual, what's the word I'm looking for? A sphere of influence.
Oh, yeah.
We all have influence in this space if we're in the room.
Yeah, and you have to be open to change. You have to be open to a consideration of what's my role. And that's typical, like we've talked about in previous episodes. If you look at any family system or couple system, everyone has a part of the cycle. What is yours? It might be less influential than the other, but everyone has a role. So how can you shape that versus like try to enforce control of somebody else.
Oh yeah.
Which you see a lot. And that's what's really hard when you think about the myth, is like they want us to fix it. And the people who come in reluctant are like, this is so uncomfortable. Just tell us what we need to do and we'll be on our way.
Yep.
Like, I don't want to do this anymore. It's so uncomfortable.
Infidelity is a big one where this comes up. My partner's the one that cheated. Yes, that is true. They committed the act of infidelity. And what happened in the system that's where we got to?
And not that it's your fault, but how do we understand it from a systemic
Everyone's
perspective?
got influence, right?
Yeah.
And it's accepting that even in those moments, barring abuse is the one caveat here. I'm going to name that. There is no systemic piece for abuse. Abuse is abuse. No one deserves it at any point. But when we look at dynamics within couples or families or individually, it's important that everyone in that space can accept that they have influence in that space. And we're not going to fix anyone. No one's broken.
Yeah.
We're going to aid in doing something different. Talk to people about updating your software. My job isn't to make you a new human. That's not going to happen. A lot of therapy is just acceptance of who you are or what's happening. But we're going to update your software. We're going to update your tools so that you can be in relationship a little bit more effectively or be able to cope more efficiently. But it's not a complete overhaul.
Yeah. And that, looking at it systemically, is a hard one to communicate and like tell clients, especially when you're working with the system, is that everyone has a role. That's a hard one to say compared to like, we're not here to fix it. And, you know, expect to feel like shit sometimes when you leave therapy. The one about systems is very hard.
It is.
Because both have to be accepting. I will never forget this, but one of my first couples that I saw, the wife was very reluctant to come in, this heterosexual couple. And she put her finger on his head and kept pointing to his head and moving his head by pointing so hard and was like, it's in his head. It has nothing to do with me. Nothing.
Oh. Well, that tells me a lot about her, but very little about him.
Yeah. So, I mean, it told me a lot about the dynamics. And so I couldn't do couples therapy. So I had to work with his side of the cycle on an individual level, managing anger, managing how to respond to that, and really breaking apart from that influence of that dynamic to see if this is really a relationship for him, because that's discernment for him at that point. Because he's like, I don't know how much longer I can put up with it. But it speaks to your point of some people are just not willing to see their role and accept that there's something wrong. And I hate that language, because it's like it's like updating software. And I look at it like it's not about right or wrong unless there's abuse. It's about how do we be more effective? It doesn't mean that you're wrong for what you're doing. It means that the culture we brought up in our families and the skills we learned just may not be working for who my partner is as a person. And the same thing goes with parenting. How I learned to parent, whether good or bad, may not be what's working for my child, their temperament, personality, whoever they are, you know, as an individual. So
it's a big one. The fix it. We hear that a lot.
And that you have an influence, that everyone plays a role. Yeah.
What are other myths that you think of?
So speaking of systems is balance.
And say more.
So this idea that when some partner comes in, they think it's the other person's fault. And our job is to keep balance. And there's like this myth that we have to take sides. There's this myth
We're not going to take sides, peeps.
Yeah, there's this myth that they'll come in and like they're going to pick and say something about me. I know they're going to do it. And that's like reluctant. And for us who are trained in systems, specifically marriage family therapists, are trained to work with couples in this way, is we don't look at it like that. We might intentionally imbalance the system as a part of an approach one day or a session or so. But our goal is always keep balance. We don't try to have perspective of who's more right or who's wrong. And a lot of couples in particular, or even parent-child, will come in with this perspective of who's wrong, like I'm right, and they'll fight for that. So that's a myth of this idea of like a therapist is going to side with one of us. And the sad part about this is I've had clients where that's happened previously in couples therapy.
It kills me.
And it's been, I was like their last chance. They're like, you're our last shot. We're not going to do it again. We had two others that they clearly like took sides. It's like,
in favor of partner.
And they favor.
If that's happening in your therapy, switch therapists, which leads to another myth. Not all therapists are created equal. We have this belief that I went to therapy, it sucked, so therefore therapy sucks. No, that's not it, right? Every therapist is different. Styles are different. Even you and I, Greg, are very different in the way we do therapy.
Yep.
Same training, well, close to same training, right? Same degrees, same licensure, but very different approaches. When you are looking for a therapist, one, make sure they are ethically trained, that they are trained well. If they say that they practice couples therapy, family therapy, make sure they actually have training in that.
In that one particular, yeah. Or
Just-
trauma, like make sure they're trained in
Yeah.
trauma work.
To just say like, I have a therapy degree, therefore I can do all these things. That's not true. We
Yeah.
see in postpartum work, right?
Yeah.
And this is my specialty, but there are lots of people who say like, I went to go get support with fertility or infertility or trauma or postpartum work,
Mhm.
and they didn't know what they were talking about. Vet
Yeah.
your people.
There's grief specialists. There's people who are training grief. That's not my strong suit.
Kids.
Yeah.
Make sure they are an RPT, a registered play therapist for little kids. Not
Yeah.
just that they one time
Mhm.
had a class that worked with 5-year-olds.
Yeah. And we're not all created equal. And it
No.
might take a couple therapists to find a good fit. And that's the most important thing. I've had clients come to me and they don't feel like I'm a good fit. They found a better fit. That's okay.
That's okay. It's
I'd
like picking
rather-
a friend.
I'd rather you have a fit and find therapy helpful,
100%.
because then you'll be happy about it and tell other people about it and see how it's important, because it's just like a dentist or your primary care provider. You've probably been to multiple, and some of them you don't like, and some of them you're really comfortable with. And it's the same thing with therapists. It's no different as a provider.
100%.
So that myth is always the one that like baffled me. It's like, why is there this assumption that if I go to a therapist, therapy should be great, and if not, therapy shit?
It kills me. And I say it's like a friend. Okay, I want to be clear. Therapists are not your friend. That is another myth. We are not going to have dual relationships here. I am your therapist. But it's like a friend in that I have to find someone I match in personality with, I feel safe with, and that I feel motivated for change with.
Yeah.
Right? If I go in and I feel like I have to have my full makeup on and have to be uptight and all the things, they're not a good fit.
Yeah.
It should feel like a space where you can let your hair down. You can be your full messy self. You as a marriage can be honest about what's happening. Not a place where I feel like I have to perform or limit or anything like that.
Right. Yeah. Yeah. And I talk about that a lot with the clients I see, especially like telehealth. I'm like, let your cat walk across the keyboard. Whatever.
Mine will too.
Your dog's going to bark. Your baby's going to cry. Like,
Yes.
you're human. I want you to feel comfortable in the space and know that life's going to continue like in this process.
Mm-hmm. That brings me to another myth. This belief that therapists somehow are judging or feel superior or don't have their own shit. Now, while therapists aren't bringing their shit into your therapeutic relationship, hopefully, because that would not be effective therapy. Can I just say that? Can feel imbalanced because the client's sharing a lot about themselves and we don't get a lot about the therapist. But that said, therapists are humans too. We are not sitting there to judge, to get the latest gossip, none of that business. If that's the vibe you're getting from your therapist, switch.
Yeah. We
also have been through a lot of the same things that we are helping people through. I've been to a marriage therapist.
That's what's drawn a lot of people to the profession. A lot of therapists to the profession is
their own junk,
their own stuff. Yeah.
So knowing that your therapist is not sitting there, hopefully, on a high horse or judging you, or that they too don't have their own dysfunction, I think it's really important.
And guess what? It does happen.
Mm-hmm.
I've had clients say that they've been to therapy where they were judged.
And it's terrible.
And the thing is therapists are allowed to practice from and their belief system to influence it. And at that time, it's ethical to say this isn't a good fit and we need to find referral, knowing that it's not going to be a good fit because the belief systems don't match up. That's totally okay.
Yep.
So that will happen. But it's not okay to like judge. That's not really what we're there for.
100%. And sometimes therapists might share about themselves. That can be okay. But there has to be a line between, hey, this is a little bit of my perspective, and a therapist eliciting support from the client.
Oh, you mean those therapists that talk the whole session and the client doesn't get to talk much?
I hear about this too often.
That's surprising. That's shocking to me. Yeah.
It just makes me nauseous of how the poor care some people receive. It just no good.
Like we said, not all therapists created equal. Another myth is that therapists prescribe medication. Not all therapists can prescribe medication. And typically it's always been a psychiatrist who's an MD or like a nurse practitioner who's able to prescribe.
Psychiatric nurse practitioner.
And now more recently, psychologists. So not every therapist, licensed clinical social workers. Now, granted, there are some caveats where somebody had some specialized training that might allow them, but it's very rare.
And it has to come with an actual license or certification to do that. Yeah.
And you'll notice that in their title. So like licensed clinical social workers, marriage family therapists, licensed professional counselors. I mean, any of that job typically aren't. So if you go to therapy, there's this expectation that they're just going to prescribe me meds. No, not all of us even can prescribe meds. It's not even on our radar. And a lot of us, my stance is that if you're not a big believer of meds, then let's work from that. And I respect that.
Different.
There are certain cases where if like there's psychosis or things on a severe level, I might suggest it.
Or even I think about like postpartum depression, right? There are times I might encourage people to go seek out that support because I talk about it like a cast on a broken bone. It's not meant to be forever. It is meant to help you heal. It's meant to give a little bit of relief so that you can do the other work.
Yeah.
Because sometimes it can feel like depression, feel too overwhelming in the moment to cope and deal with it. So I need a little relief so I have the capacity to actually deal with it.
Yeah.
But in that case, we refer out ideally to a psychiatrist, not a primary care, none of that business. Because psychiatrists are specialized much like cardiologists for the heart.
Yeah.
Psychiatrists for the brain. They know what all these meds do, the interactions, the side effects, how long you should be on them.
In the context of mental health.
Yes.
Yeah.
Whereas primary care know a lot about, or a little about a lot of things.
Yeah.
You really want someone who's specialized because these meds can be challenging.
And you might not find the right med the first time. And like you, I think about it like that too, is some people, just because of how their brains work, might need something like this persistently through their whole life, just whoever they are. The other part is that it's oftentimes keeps you more regulated to then actually benefit from therapy. And this is why some of the research out there, and we've talked about this before, is like 80% more effective with medication and therapy together compared to either of those alone.
I believe it. And the hope is you eventually taper off. Now, some people don't produce serotonin like they should, or what have you.
Yeah.
And in that case, okay, might be more of a chronic thing.
Or the other neurochemicals that are associated with these, right?
Sure.
Yeah.
But in any case, we are not the prescribers unless it is specifically given to us through our licensure.
Yeah.
That's an important one, right?
It's a scary one. I mean, there's a lot of liability with the medication stuff. And I think personally, my own personal thing for myself as a client would get a couple opinions before I go on any. That's just me and where I'm at. And there's nothing wrong with that. You can have a primary therapist and say, I'm going to go consult with a psychiatrist, like maybe a couple of them, to see what their thoughts are.
Yeah.
And that's totally fine. As long as they obviously make that known ahead of time to the other providers. But I mean, you're looking out for yourself. This is you trying to take care of yourself, and there's nothing wrong with getting those perspectives.
Another myth is that I hear people say therapy can't work for me.
You're just so special.
Oh, golly. This one drives me nuts, Greg. Because
is that the narcissist? Or
I don't think there's a single person, and I could be wrong. I don't think there's a single person that couldn't benefit from therapy. And I get that that's a broad sweeping statement.
Yeah.
And
we're biased, but of course. Yeah.
But this belief that no, they can't work for me, or that's hokey, or whatever, or it's for the weak. I hear that, right? If you're going to therapy, you must be insane or weak. No.
That's a huge myth. That's a big one.
Kills me. No, just about anybody can benefit from therapy, from processing, from fine-tuning skills that you probably weren't given. Even as therapists, we often go to therapy. We have all the tools. When we get that outside perspective, it can open up your brain in a different way than if I'm just staying in my narrow path.
Yeah, and I get that people have different perspectives, right? They won't go to a doctor or a dentist until something is wrong, and they'll do the same thing with therapy. They won't come to us. Unfortunately for us, I would say a large percentage of those, the majority, come when it's probably a little too late, like a
the 11th hour. Yep.
11th hour. But there's also this other perspective that I think we're trying to move towards in terms of self-care, and it's kind of the preventative maintenance. Like go to the dentist to get your teeth cleaned so you can not have to worry about the pain to then have to go back to that you can kind of maintain it in a healthy way. Same thing with therapy. You can come here for growth, learn new skills, just process, see where you're at, maybe a checkup. Same thing with PCP. You do annual checkups. You don't have to be like hurting all the time or something wrong to go to a doctor.
Yeah. I have clients that come once a month, once every 6 weeks. Now, I wouldn't advise that if you are in active crisis, if you're struggling with depression or anxiety. These are people who've already done therapy, but they're maintaining a maintenance schedule so that they can process through, okay, this last month, anxiety got me a little bit on this day. Okay, let's process what happened that day and plan. Right? It allows for little tweaks.
Yeah.
So helpful.
And it's really important too, because I think what I hear a lot with clients is we got lost in everyday life. And I'm like, I get it, because guess what? You're learning a new skill, and this has not been present in your life or known as long as your previous habits. And so therapy sometimes, even if just a month, serves as accountability of the skills they've learned through the time working, right? Because typically we'd start off more regularly, like once a week, or if crisis might be a little more than that, and then titrate away.
Yep.
And then once you titrate away and it's less frequent, it could be that maintenance like you're talking about. And that's where like the accountability of like, oh crap, we haven't been prioritizing our relationship. Let's make that a goal. Let's put that on our schedule. But you don't have to be weak to go to therapy or ill. You could just be proactive and put yourself in a position to be able to navigate life in, I think, a more healthy way compared to what we typically do as humans.
Or quote, I have to be crazy, or people are going to think I'm crazy. You're worried about public perception. One, you don't have to tell anyone you're going, though I would say it's nothing to be shameful about. But it doesn't mean you're insane. It doesn't mean you're weak. It doesn't mean any of that. It means that your software is outdated and you got to update it.
I always say this is like, nobody else is living your life but you.
True.
So does it really matter what they think? Would you rather suffer or worry about the perception that you're weak or ill going?
Truth. Another one. Therapy is one session. We're going to solve it all in one session or two.
That's typically mine. Is that not your?
No. There are models of doing therapy that are certainly quicker than others.
Yep.
One is solution focused, right? That one, it's typically more compressed. You're looking at single digit number of sessions. Other models might be a little bit longer. And each therapist is going to operate from a different lens, a different way of doing things.
Yep.
Some, like myself, are eclectic. So I pull from a whole bunch of different models.
Yeah.
But in any case, therapy is not going to be solved in a day. Your struggles that bring you here are not going to be solved in a day.
And that's why you have to be ready.
Yeah. It's a commitment. You have to put in the work.
Like going to the gym. It's like this thing. It's a commitment.
You can't go once and be like, there goes 50 pounds.
Yeah. Why did I go once and I didn't get abs? What the hell?
What? It's the same thing.
Yeah.
And there are going to be ups and downs. There are going to be times when you feel really good and you might taper back a little bit on therapy, and then life gets a little hard again. Okay, then you bring it back again. But it's not a single session.
Yeah.
It's a tough one. Any other myths you can think of, Greg?
I know. I was just thinking about that. We've touched on a lot.
Oh, one other would be virtual. I was thinking about this with virtual therapy.
Oh, yeah.
That virtual therapy is less effective than in-person therapy. It kills me that I hear this. For some people, yes, there's absolute benefit of being in person, especially if you're doing movement therapy, dance therapy, art therapy, EMDR.
Yeah.
Though that can still be virtual. Virtual therapy, although it can feel weird at first, it is absolutely effective. My entire practice is virtual.
Yeah.
And my clients haven't suffered for it. In fact, for a lot of people, it's actually beneficial because they are potentially at home where they're comfortable and have that blanket that's comfortable. Maybe they get to do it on their lunch break, so they have more flexibility in the provider they choose. I have couples, if they had a fight last night or struggling with intimacy, go sit in the room in which we had the fight. Go sit in the bedroom and let's talk about it there, right? And it brings them kind of back into that space. But there's a lot of benefit to virtual that in-person doesn't have. Now, in-person also has benefits, but it doesn't mean one is superior or inferior to the other.
Yeah, part of it's fit. In certain cases, I would argue like trauma. Like I don't want someone to do therapy in the home or the place that maybe the trauma is happening. I'd rather them have like a space to go to. And you can still do virtual. Maybe it's just in a different space and not that place. The other thing too, and the number one barrier for people going to therapy is logistics.
True.
Telehealth wipes that out. And so when I hear the excuse that you're busy, I'm like, well, you're not driving anywhere. You're, and
you're gonna eat lunch anyway.
And I see clients all over the state. And that's what's great about it is now that opens up possibility to providers and fit. And you're not like only
within your town
or something like that, which might be small. So I love the access it gives. I love that it helps with logistics, especially if you have littles and kids. I mean, that's a huge barrier for families.
But that right there speaks to style too, right? So I was recently on a mom Facebook group, and this woman had been going to a therapist with her partner for quite a while while they were pregnant. And then she gave birth and she was holding her newborn. And the therapist said, no, you can't have therapy with me if you have that baby here.
Oh.
And it's such a stylistic thing to me. I was like, why not? And you learn a lot by watching partners interact with babe. Yes, I hear the distraction piece, whatever. But finding that good fit, I want to go back to that because I allow kiddos in that space. Now, caveats. If they're old enough that they understand what's going on, we're not fighting in front of them. We're not doing all that business, right? But often parents at night, their kids will go watch their iPad for an hour in their bedroom while they do therapy. It gives them that flexibility when they can't afford a babysitter, when they don't have time, when they don't know someone who can be a babysitter, whatever it might be.
Yeah, that used to be attraction back in the day before like the telehealth, before COVID was like, well, we have a sitter or we have a room where the kids can play in toys. Like that had to be a thing. And now it's like, nope, you can do it from the comfort of your home, which is nice. And it is all fit. And I think that's really important. You're going to feel like crap. You might not like the therapist that you're going to see. You might feel judged. Find another one. Don't give up. It's not therapy. It's usually the therapist. And there's clients, I mean, I'll be honest, there's clients that don't like me. They don't like my style.
And that's okay.
Totally fine. I'd rather you find a fit.
100%. One last myth that came to my brain. I will never work harder than you do. This belief that therapists are somehow responsible for the change, responsible for the work, or going to have to work harder than the client. Nope. I will never work harder than my clients.
Yeah. If you're not doing the work, I'm going to sit there and say, all right, well, what do you want to do then? If you do not do the work, I'm not coming to fill the session.
No.
This is your space. You use it how you want. I've given you tools. If you're not doing the work,
I can't help you.
I will talk about what's keeping you in barriers around that, which is often not a good conversation because it's boring a lot. So,
but I can't work harder than my clients. Any other myths for you, Greg?
Not that I can think of. I mean, I think we covered a lot, and I feel like if anyone has questions or thoughts or any other myths that they think about, it would be like, I would love to hear them and share them with us so we can kind of maybe process them in a later episode.
Myths are important to talk about because if we can help demystify therapy and help to loosen the stigma around therapy and mental health just a little bit, it can be so powerful. Everyone has mental health, whether it's poor or not. That varies by person, but everyone has a duty to do something about it, like you do your physical health.
And what's so interesting, and I think whether you want to see this as a myth or not, but people view it as a luxury. Yeah. And it's a sacrifice. And it's kind of like how much mental health is integrated into physical health and connected to physical health and responsible for the exacerbation or even manifestation of symptoms, physical symptoms. It just baffles me that it's kind of seen that way.
As a lesser than, but it is so important. Everyone has physical health. Everyone has mental health. You've got to take care of both. You can't just do one or the other.
A great example of this would be, before we wrap up here, is that people doing trauma work, and when they experience physical pain and somebody processes, a lot of times from the trauma perspective, that physical pain is tied to trauma. A lot of times when we go and think about the pain and bridge it back, there's a memory that comes up with it. And I think about like somebody who maybe had some trauma during giving birth.
Oh yeah.
And they have a lot of like pelvic pain or like hip pain or something. And you process that, you'll see these clients' pain dissipate. Right. And this is after like the doctor's like, we don't know, like we're not seeing
there's no abnormalities.
And then all of a sudden, like you process that trauma, it goes away. And it's like that trauma is being stored in the body as pain.
Got to keep score. Yeah. Okay. As always, if anyone has any questions or thoughts or topic suggestions, feel free to email us at relationshipsinsideout@gmail.com. We thank you for listening.
Thanks.